you. Good evening, good afternoon, 145th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. ANSHU. We welcome all to the session. Let us begin the session with 1 minute silent prayer. Thank you all. All of you know that International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session is already today, the Hindi session from 7:30 to 8:30 and 8:30 to 9:30, the international session in English, and 9:30 to 10:30, a local language session in Malayalam. And we got a wonderful guest in Dr. ANSHU. Dr. ANSHU has completed MD Homeopathy, then she is a PhD scholar and diploma in nutrition and health education, and she has done a certificate course in hospital management also, working as the professor and Department of Repertory, Homeopathic Medical College and Hospital, Chandigarh, and where she has more than 22 years of clinical experience. That means a very, very good experience, and we'll be discussing about one of the best subjects, as you know, the PCOS and its homeopathic management. This is one of the area where homeopathic doctors can do wonders, and we are getting a lot of successful cases treated by different doctors from all over the world, and we have a lot of presentation on this subject also. But
thank you, sir. Thank you. Good evening, everybody, and happy Independence Day to all of you. I'm here to present a paper presentation on the PCOS and its homeopathic management. So let's talk about something about in relation to that of the reproductive system. So PCOS has been a very prevalent. A few years back, it was very much prevalent in above 30 years of the females, but now it's too much prevalent in the young girls. So it's a matter of worry that reproduction is being affected because of this syndrome, and it's too much seen in the young girls around the 15 to 30 years of the age. So just starting with the menarche, and the major part of the reproductive age is being affected because of the PCOS, and its prevalence is too much. Now, I'll just beginning. The other names for the PCOS, or we call it as PCOS, includes polycystic ovarian disease, functional ovarian hyperandrogenism, ovarian hypertrichosis, sclerotic ovary syndrome, and Steen-Leinenthal syndrome. So, in the beginning, when it was being diagnosed or it was being seen more prevalent as a polycystic ovarian disease, but when the other factors were included, all metabolic and other hormonal factors were included, it was named as PCOS. So it became a syndrome. So originally it was described by Steen-Leinenthal in 1935. So the disease was earlier known as Steen-Leinenthal syndrome also. The definition, which is very important here, is just a second. The definition in the here is it is a multi-system. Am I visible?
yes. Yes, sir.
So you're not visible to me.
Yes, sir. Yes, madam. You can go ahead.
Okay. So the definition for the PCOS is it is multi-system endocrinopathy with the ovarian expression of the metabolic disturbance and a wide spectrum of the clinical features like ovulatory failure, hirsutism, obesity, glucose intolerance, resistance to the insulin, dyslipidemia, infertility, and enlarged polycystic ovaries along with the metabolic disorders. So you can see there are 8 things which are coming up as a syndrome. So including with that of ovulatory failure, hirsutism, obesity, glucose intolerance, resistance to insulin, dyslipidemia, infertility. So I'll go in detail with all this. Now it varies it is the incidence is from 0.5 to 4% is there, and the main cause for the increase of PCODs is change in the lifestyle and the stress, and it is more often seen in the infertile women. No doubt, it is causing infertility, but it is do causing uh, uh, infertility may be there can be PCOD in case of infertile woman, and it can be other way around. So most often it is seen in the 15 to 25 years of the age when the disease begins soon after the puberty. So it starts immediately after the puberty and it manifests during the whole of the reproductive period. So it can be variable from 15 years to 25 years of the age. The disease has a genetic and a familial tendency, and it is autosomal dominant inheritance is there. So it has been found that if a mother is suffering with some hormonal imbalance, it is being seen in the uh, daughter also. So it has got a genetic as well as a familial tendency. Secondly, if the father has suffered from some heart disease, the, the daughter may suffer from the PCOS. So it's not only from the mother side, it can be from the father side also. So the risk factors for the PCOS is obesity, family history, sedentary lifestyle, and age between 15 to 30 years. These are the risk factors for the PCOS. Now, I'll just go through the short study of the physiology of menstruation because this is all related with the menstruation. Usually, the female comes with the oligoamenorrhea or amenorrhea is there, but we should know what happens in the menstruation. The hypothalamus secretes the GnRH hormone, and it is it acts on the anterior pituitary, which releases the two hormones, which is luteinizing hormone and FSH. So, luteinizing hormone surge leads to that of ovulation, and FSH helps in the maturation of the follicle stimulating hormone. Ultimately, from the ovary, estrogen and progesterone are being secreted, which gives a feedback mechanism is there to the hypothalamus, and this is how the menstruation cycle goes on. But in case of this is a short picture of the again normal menstrual cycle. So GnRH is being released from the hypothalamus and it acts on the pituitary, releasing the FSH and LH. No doubt from the theca cells, few androgens are being secreted, but the estrogen and progesterone are the more dominating hormones, which leads to the LH surge leads to that of ovulation. But in case of PCOS, what has happened? So when the GnRH is being released, it is not in a normal pattern. So there is an increase of the GnRH increases there, which leads to uh, uh, release of the LH is there, FSH is there, but the FSH drops, which is a follicle stimulating hormone, which matures the follicle, and LH rises. Where should it should be other way around? So there is an increase of androgen, leading to that of more of testosterone levels. So no ovulation occurs. Ovulation is being inhibited because follicle stimulating hormone is not being released. The follicle is there, but it is not maturing. The LH flirt is not leading to that of ovulation. So no ovulation occurs. The follicle is there. Now the fault often lies in the ovary and or related to that of the hypothalamic pituitary ovarian axis. The chronic non-ovulation and the hyperandrogenism associated with the raised estrogen and raised LH and FSH, low FSH and LH ratios are there. Now it comes up. How does it come? It comes with a picture of an amenorrhea, hirsutism, obesity, and enlarged polycystic ovaries. I'll show you the picture what happens. And there is a missing of the menses. So either the menses become scanty and or there is a skip of the menstrual cycle. So excess of androgen doesn't lead to that of the role of estrogen and progesterone gets hampered because of the excess of the androgen releasing. So there is a skipping of the cycle also and it interferes with the ripening of the ovarian follicle. So because PCOS is affected, it affects 5 to 10% of the female population. So it's most common endocrine disorder, one of the most common endocrine disorder, which may lead to and one of the leading cause leading to that of the infertility. So coming to the pathophysiology, we don't know the pathophysiology of PCOS. it's obscure. It's still not clear what happens. There is an abnormal pulse frequency of the GNR stimulus, which leads to the increased pituitary sensitivity to GnRH. And again, the GnRH, because the progesterone gives the negative feedback mechanism, and there is again a which leads to the polycystic ovary. So LH secretion is being elevated due to the persistent high level of the estrone and androgen both, and FSH secretion remains either normal or decreased. Whereas when in case of a normal cycle, the LH surges there and follicle stimulating hormone increases. Whereas in case of PCOS, LH secretion is being elevated. So FSH secretion is remained. So follicle stimulating hormone is there, but it's very less. So follicles is there, but it's not maturating. LH surge is not leading to that of the ovulation. So relative low level of FSH leads to defective ovarian follicogenesis. So that is due to the lack of erythromerization. The net effect is being diminished estradiol and increased inhibin production. And due to elevated LH, there is hypertrophy of the theca cells. Now these theca cells increases androgens. So more of testosterone are being produced by these theca cells. So this order is characterized by excessive androgen production by the ovaries and the adrenals, which interfere with the growth of the ovarian follicle. Now, these are the two reasons which leading to that of the polycystic ovarian disease. Now, there is an insulin resistance also, which may cause increase of the androgens, and the female later on may become diabetic if it is not being checked. Now, what happens? The insulin is being treated by the pancreas and it affects the ovarian region, which leads to that of the increase of androgens in the theca cells of the ovary and in the adrenal cortex. Now, these androgens give us negative feedback effect on the hypothalamus and the pituitary, leading to again the hormonal imbalance complications. Again, the hormonal imbalance leads to difficulty in the ovulation. So, ovulation is not occurring. So again, insulin sensitivity is increased, leading to more of the insulin is being secreted. So it leads to insulin resistance, and insulin resistance causes in leading to that of the theca cell stimulation. Again, coming to that of increase of androgen. So this vicious cycle goes on. Now this is the summary of the PCOS. So what happens when the GnRH being normally is normal pulsatile fashion is increased, then it is okay. The normal menstrual cycle goes on. But when there is a abnormal release of GnRH, it leads to polycystic ovarian disease, and FSH and LH is being secreted. The FSH is acts on the granulosa cells, and LH acts on the theca cells. Now, there is a no progesterone surge because of progesterone is not released uh, from the ovary. So GnRH pulse frequency is abnormal, leading to the LH patient cells sensitized to higher GnRH pulse frequency, and there is increased LH which stimulates the androgen synthesis. So too much of androgen secretion leads to hirsutism and acne. Now, hirsutism and acne come there. With that, there is an insulin resistance also, which leads to that of the increase of the androgens. So this leads to uh, decreased likelihood of the successful ovulation. So we don't have proper FSH and LH is raised. So there is the ovary has a follicle, but it is not maturing. No ovulation is occurring. Again, the progesterone level surge, no progesterone level surge is there. GnRH is not being reduced. This cycle goes on. This is a summary of the PCOS. Now, again, this hypothalamus GnRH leads to this androgen, adipose, and estrogen levels. So it affects the androgen affects the skin, which leads to hirsutism. Hirsutism is the facial hair, appearing of the facial hair, acne. Acne, insulin resistance is there, follicular atresia is there, which leads to the anovulation, and Because the estrone level is also increased on the uterus, it leads to the endometrial hyperplasia. So it came later on as a complication if it is not being corrected here. So it induces insulin resistance and hyperinsulinemia, in which in turn increases the gonadal and androgen production. Obesity is also recognized as an important contributing factor. Apart from the excess production of androgen, obesity is also associated with a reduced sex hormone binding globulin. Now, the cumulative excess of unbound E2, that is estrone and estradiol and estrone, results in a tonic hyperestrogenic state, and endometrial hyperplasia also occurs because the uterus is preparing to get a mature follicle, but it is not being received and it is not being released. So the uterus is again preparing itself for the follicle. So it increases the endometrial hyperplasia there. So the pathogenesis, when we sum up, is that there is the root cause of the PCOS is insulin resistance, hyperinsulinic state, decreased sex hormone binding globulin, increased E2 levels, and again negative feedback on the anterior pituitary, and this vicious cycle goes on. Now, this is the normal ovary where we can see there are ovulation is being occurring. Whereas in case of the woman with the PCOS, the follicle development is there, but it is not being released, and there is an action of the cyst is there, and there is a release of the male hormone. So there are number of cysts are also lying. So you can see here also how many there are number of cysts which are lying. This is the normal ovary with the primordial follicles, primary follicles, secondary follicle, and mature follicle. And the corpus luteum is there after the ovulation. So when the ovum is being released, there is a corpus luteum and corpus albicans. Whereas in case of polycystic ovarian disease or PCOS, so the cells are there, mature, multiple immature follicles are there, and they get collected. They become cystic because no ovulation is occurring. So the pathology is typically the ovary is enlarged 2 to 5 times in the normal size, and the stroma is being decreased. The capsule is thickened, and it becomes pearly white. And when the bisection is being taken, this follicular cyst measuring about 8 to 10 mm in diameter are crowded with the cortex. So this is a normal ovary. We are developing egg is there, and this is the polycystic ovary. There are multiple follicles are lying. Now coming to the histology part, the cysts are follicles of varying stages of the maturation and regression are lying. All type of stages of the follicles are lying. So they become cystic. There is a fluid inside. There is a thickening of tunica albuginea, and there is a theca cell hypertrophy. Now this is the summary again. What does happen? How the symptoms will come. So the genetics is a one factor, the lifestyle. So obesity, lifestyle, diet. In today's date, the diet which is being taken is very much affecting the females, the lifestyle, sedentary lifestyle. So it all leads to the biomedical changes. So release of the androgen and insulin is there. Adiposity is there. So again, the obesity is causing a problem, which leads to the metabolic syndrome, and this obesity may cause non-alcoholic fatty liver disease. So it may come as a complication. And if it is not being treated here, this obesity may lead to the cardiovascular diseases. And the insulin is being affected, leading to the hyperinsulinic state, becoming an insulin resistance, and may become later on, because of the obesity and the hyperinsulinic state, the patient may become diabetic. Now, this androgen is also causing hyperandrogenism, leading to that of oligoovulation, causing infertility, irregular menstrual cycles, hirsutism, acne. So, all main pattern distribution of the hair is there. So, these are the hormone-driven manifestations, which includes acne, hirsutism, irregular menstrual cycle, infertility. Whereas the metabolic syndrome-related manifestation of PCOS are insulin resistance, diabetes, cardiovascular diseases, and non-alcoholic fatty liver. So that is why we call it as now PCOS, polycystic ovarian syndrome. So multiple things are going on, multiple manifestations are there now. So the clinical features for the PCOS is increased obesity and menstrual abnormalities are there, which is oligomenorrhea. Less of the menses are there, the cycle is big. The menses which should appear between the 21 to 35 days, they become late. Amenorrhea is there, anovulatory dysfunctioning is there, infidelity is there, hirsutism is there, acne and male pattern baldness and thinning of the hair is there. Now this is the hirsutism. Look at the pattern. The hair are appearing on the chin, male pattern distribution, beard-like hair are appearing. So this is hirsutism. Then acne is there, too much of it. These are the effects of the androgen, testosterone levels. Then there is a thinning of the hair, male pattern baldness is there, and thinning of the hair is there. So this is, we call it as a beard lady. Obesity is another reason. PCOS may lead to obesity and obesity may lead to that of PCOS. We don't know. It can be both ways. Now, it affects the reproduction also. There are recurrent miscarriages. If in the beginning there are recurrent miscarriages, because it's seen in around 50 to 60% of cases of women with more than 3 pregnancy losses. So more often abortions are there, and it may lead to that of infertility. There is another condition which is called as acanthosis nigricans. This is because of the insulin resistance. This is a specific skin condition because of the insulin resistance. There is thickening of the skin and it becomes pigmented, especially on the folds of the skin, which is nape of the neck and inner thigh and axilla. I'll show you the picture. Just a minute. So this is acanthosis nigricans. So this is also seen in the pre-diabetic condition. So it is an indication that the patient may become diabetic also. So I told you insulin resistance is there. The patient later may become diabetic. So it is a predisposing condition, or it is a sign that the patient may become a diabetic later on. So there is subfertility because it's the commonest cause for the anovulatory subfertility and it may lead to that of infertility. Now the patient may present with the features of diabetes mellitus, deepening of the voice. Why deepening of the voice? Because of the androgen and testosterone levels. And this may ultimately lead to later on depression, oily skin, and dandruff. It has been seen there is a sleep apnea also. The sleep apnea is being seen where the obesity is there. It clogs the part and it leads to the sleep apnea. So on examination, the bilaterally enlarged cystic ovaries are seen and may not reveal due to the, when the ultrasound is being done, sometimes the bilaterally enlarged cystic is not seen because of the obesity. So there is a typical syndrome which is there, which is Hieran syndrome, where hyperandrogenesis and insulin resistance and acanthosis nigricans is there. See, these are the three conditions which indicate that the patient may suffer from the PCOS. So hyperandrogenism, insulin resistance, acanthosis nigricans. So there is a Rotterdam criteria to diagnose the PCOS. That is, first is irregular or absent menses. These are the three manifestations out of two. Out of these three, two are important. So two should be there to give a diagnosis of the PCOS. Irregular or absent menses, elevated levels of the androgenic hormone, or enlarged ovaries. So out of these three, two should be there to give a diagnosis to a female that the patient is suffering from the PCOS. Now coming to the investigation, it's very easy now because we know the LH is high and FSH is low. So the ratio between the LH and FSH ratio is 3:1. Wherever when the serum levels where the LH is more than that of FSH level and it is around 3:1, we can say the patient might suffer from the PCOS. So there is reversible estradiol, estrone ratio and estrone level is markedly elevated. Sex hormone, uh, sex hormone globulin level is reduced. So androgens are increased. The serum testosterone level is marginally elevated. And test for the polycystic ovarian disease is confirmatory by the high levels of LH, and there may be even normal level of FSH or they are altered even. 2:1 or 3:1 ratio may be there between the LH and the FSH in case of PCOS. Androgen levels are higher than that of the normal level. And the insulin is also found to be much higher. So when the glucose tolerance test is to be done, insulin resistance is the body inability to properly. So a fasting glucose on the insulin ratio is less than 4.1, 4.5 is to 1 can indicate that the patient may be suffering from the insulin resistance. So higher levels of insulin indicate that the patient may suffer from the PCOS. So blood sugar levels, fasting blood sugar level is raised, and even the PP levels are being raised. The cholesterol is increased. Cholesterol levels are also increased. HDL, LDL levels are increased. It may be because of the obesity or impaired lipid metabolism. Thyroid levels are also deranged. Sometimes it is very low or sometimes it is very high, but they are to be uh, uh, the levels are to be the investigation for the thyroid hormone should always be taken because thyroid is also which leads to an ovulation. So it should be differentiated whether the patient is suffering from the hypothyroidism or she is suffering from the PCOD or PCOS. Prolactin levels are often found to be increased, and it shows a very typical picture. Ultrasound shows a very typical picture in case of PCOS, because that is polycystic ovarian disease. That is a necklace-like appearance is there. So I'll show you that necklace-like appearances because of the uh, multiple cyst lying inside the ovary. So this is the ultrasound. This is the normal ovary where nothing is being seen. This is the normal ovary. Whereas when we see the polycystic ovaries, this is the necklace line. There are multiple cysts which are lying. Immature follicles are lying. So it is a polycystic ovary. So look at the ultrasound. Beaded necklace appearance is there. So number of cysts are lying in the ultrasound. You can see that. Look, how many? There are a number of cysts. So when the laparoscopic examination is being done, that reveals thickened, smooth, and pearl-white outer surface of the ovary. I'll show you the laparoscopic examination also. So look at the polycystic ovaries, laparoscopic one. Look how big they are. They're just pearly white. Both the ovaries are polycystic. Look at the size, how big they are. Number of cysts are lying. So big in size. This is a single ovary. In the previous one, they were both the ovaries were polycystic. Here in this is a single ovary which is polycystic. This is the laparoscopic view. Now, the complications which arise because of the PCOS are diabetes, infertility, and endometrial carcinoma because of the hyperplasia of the endometrium. So, if it is not being treated, it may lead to that of endometrial carcinoma later on. This is a complication. And obesity, LDL, dyslipidemia, it may lead to that of a cardiovascular diseases, and depression is one thing which also arises later on. So the management part, the medical treatment for the PCOS is being tailored. So most important things which are to be taken care of: obesity, lowering the insulin level, and to restore the regular menses. Whenever the menses are being restored, the patient is better always. So a restoration of the fertility is there. Treatment of the hirsutism and acne is there. These are the 5 things which are to be taken care of in management. That is obesity, lowering of the insulin levels, restoration of the regular menses, restoration of the fertility, ovulation, and treatment of the hirsutism and acne. Now, in the modern science, the pills are given for the irregular and active menses. The progesterone pills are given, and for the fertility problem, ovulation inducing medicines are being given. FSH injections are being given. Uh, IVF is being done. Surgery is being done. But these all leads to the some or other complication in the female. No doubt the surgery is also there. Look at the surgery, how the drilling is being done or the diathermy is done with the electrocautery. So this is puncturing of the ovary is being done just to rupture the follicles. Now, the prognosis for the disease is there is no cure, but we need to manage the symptoms. We can treat the patient with homeopathy. The management is very important here. Homeopathic management really helps. Restoration of the menstrual cycle is very important. So it also reduces with the management, we can also reduce the risk of the complications such as the heart disease and diabetes. Now, diet is very important because obesity is one reason. Obesity may lead to PCOS or the PCOS may lead to that of obesity. So, diet is very important. So, in case in overweight women, the symptoms and the overall risk of developing the long-term health problems due to PCOS can be greatly improved by losing excess weight. So, the weight management is very important. Weight loss of just 5% can lead to the significant improvement of the PCOS. So, when the body mass index improves, the the restoration of the menstrual cycle is also there, which is very important. So weight is very important. Losing excess weight is very important. That is why it is a lifestyle change. And obesity, sedentary lifestyle is one reason leading to that of PCOS. So lifestyle changes include eating a healthy and a balanced diet, exercise regularly, losing weight, and reducing opportunities for the rest and anxiety, and avoid smoking. So meditation, stress, all these things really reducing stress, all these things really affect the patient and patient can improve. So coming to the miasmatic view, initially it is the soric miasm which bring about the functional changes. Up to the that of the hormonal changes, it is that of the soric miasm. But whenever it becomes cystic, it leads to that of a psychotic miasm. So cystic changes are there after the soric miasm. So initially it is a soric miasm which brings about the functional changes, followed by the psychotic miasm when cystic changes are there, and PQS has both sora as well as psychotic miasm in the sick individual. But this when it leads to that of the cancer pathology, when endometrial hyperplasia may lead to that of a carcinoma of endometrium, if there is a cancer pathology, which tells us that there is a syphilitic miasm. Now, coming to the homeopathic management, how we can manage it. Homeopathic treatment for the polycystic ovarian syndrome is very safe and free from any of the side effects. Both physical and the mental sphere of the patient are thoroughly to be investigated while prescribing. Homeopathic medicine is required to extract the disease from the roots and varies from case to case. We know that we treat the patient as an individual. So there are few medicines which have been taken from the repertory as well as from my experience. So the best homeopathic remedy for the cure of PCOS is CPR. So wherever there are late and scanty menses, which is one of the symptoms for the PCOS, bearing down sensation is there in case of the pelvic region. So ovaries remain enlarged with the fluid-filled cyst is there in case of CPR, and abnormal hair growth. So all the conditions which are for that of PCOS are there. They are in CPR, late and scanty menses. Ovaries are enlarged, abnormal hair growth on the face, and it regulates the menstrual cycle. So when CPA is being given, it leads to the cycle. When the cycle improves, rest of the things also improve. Pulsatilla is another medicine which helps. So homeopathic medicines for the suppressed menses for the long duration. So it is especially benefited for treating the PCOS cases in females who suffer from the suppressed period for the long duration. There is a check in the period. When they appear, they are very scanty and they are very painful. So CPR is really helpful where the suppressed menses are there and they are scanty. So it removes the obstacles that causes the periods to be suppressed and the period starts to flow normally. Calcarea cough, homeopathic medicines for prolonged and diffuse periods that have prolonged more than that of a usual duration. Because whenever the menses appear in case of PCOS, Either they are oligo, very scanty, and if they appear after 2 to 3 months, they are prolonged. So in that cases, with the calcarea is really helpful. Calcarea is also indicated for the fat, fair, and flabby. So obesity is also there. Weight gain and obesity is also there. Indicated for those people where weight gain and obesity is there, diffuse periods and prolonged more than that of the usual duration is there. So calcarea helps such women in reducing their excessive weight very effectively. Natrimute. So Natrimure is the medicine for the irregular and suppressed menstrual cycle. To treat the woman with the PCOS who has irregular and suppressed menstrual cycle. It helps in regularizing the menstrual cycle. Natrimure should also be considered for the woman with difficulty in conception due to PCOS. So in case of infertile cases, this Natrimure is really helpful. Thuja. So where the menstrual flow is retarded. Multiple cysts are there. It is a psychotic medicine. So multiple cysts in the ovary, it dissolves the abnormal growth and accumulation. So it has a supreme power to dissolve the cyst, and it is has been seen. It is a left-sided. The puja. Most of the women requiring puja have a cystic growth more pronounced on the left side of the ovary. And puja is of great help in the treatment of the extreme hair growth on the unusual parts in the woman due to the hormonal imbalance. So cyst, hirsutism, and left-sided ovary if affected, Suja acts beautifully. It can be used as intercurrent medicine for the PCOS. So there are various other medicines for the suppressed and the absent menses, that is pulsatilla, which is one of the top medicines for the suppressed and absent menses. Kali Carb, Seneco, these are the most commonly used medicines for the suppressed and absent menses. And homeopathic treatment for the scanty and short duration period of PCOS is for the menses remaining only for the few hours. That is the homeopathic medicines where the menses remain for the few hours is euphrasia, crocus, and sorina. CP and pulsatilla can also be very helpful where the menses only remain for the one day. So short periods, scanty menses, euphrasia, sorinum, crocus, sepia, pulsatilla can be helpful. Homeopathic medicines for the polycystic ovarian disease with the irregular menstrual cycle. So the selection of the homeopathic medicines that are helpful in regularizing the menstrual cycle is based on the individual case presentation. Natramute, Pulsatilla, Sepia are the top polycystic ovarian syndrome medications in homeopathy. So they're really helpful. Ovarian diseases for reducing the excessive hair growth in the woman. So wherever the hirsutism is there or male-like pattern is there in case of a woman, CPI is really effective. So CPI is preferred if there is a hair growth on the upper lip, hair growth on the chin. Oleum jack is of really helpful. It is a great help. Oleum jack medicine can be used. Even puja uh, is for great help for the excessive hair growth anywhere on the body, maybe on the face, legs, and arms. And for treating the acne and pimples, sulfur and silicea are really helpful. These are the homeopathic medicines which are helpful for acne and pimples, sulfur and silicea. So dealing with the obesity in a woman due to PCOS is calcarea carb, graphite, and ammonium carb. So in short, we can say the homeopathic treatment for these conditions is always based on the constitution of the patient, and the medicines vary for each patient depending upon the particular symptom. And the for the treatment of PCOS, early diagnosis in the treatment can help to reduce the risk of many of the complications. So women who have PCOS should receive regular medication, including the screening of diabetes, high blood pressure, high cholesterol, and should maintain a very healthy lifestyle by eating the right food and exercising regularly. Because obesity is the main reason, lifestyle is the main problem which may lead to a PCOS. So early diagnosis is very important and checking all the investigations to keep a tab on the sugar levels, blood pressure, cholesterol. These really help to know early about the PCOS. So this is all about my presentation on the PCOS and its homeopathic management on. Thank you. Am I audible to you, sir?
Everything fine, doctor. Everything went well also. Uh, it's really a very good session indeed, and we really noted the your knowledge in. You have really exposed the beauty of homeopathy in these cases, because all these medicines are supposed to be used whenever there is a requirement. Unfortunately, most people does not know about the beauty of homeopathy for these conditions. That's why most of the people are going for steroid treatment, and after coming coming towards us when they have a lot of steroids in their body, and that will really produces more harm than good. What's your opinion on that, doctor?
I'm not.
Usually,
Kindly, little bit loud, sir. I'm not
yes,
able to hear
yes,
you properly.
you may not be. Anyway, what I was telling us that it is really a very good session indeed, and
Thank you, sir.
usually since most of the women when go to the gynecologist, and they may prescribe the steroids for the treatment, and they may took a lot of steroids in between. When they come back to us, we may find a lot of complications. Uh, in those conditions, what is the attitude of you in that treatment, or what kind of line of treatment you opt for?
We need to keep a tab on the investigations. No doubt, we give the medicine on the constitutional basis. We repertorize the case and we prescribe it on the constitutional basis, but we need to keep a tab on the investigation, because investigation is the most important indicator which tells the patient is whether improving or not. And second thing is the appearance of the menses. So if the patient has come with that of a menstrual cycle with 1 day menses, and with the medication the menstrual cycle has come to 2 or 3 days, that's a good indication that the patient is improving. Third, which is very important, is obesity. So reduction of the weight and stress in life. Stress has to be controlled with the patient. It's not in the doctor's hand. So meditation is really helpful. And lifestyle problem, which is obesity because of the indoors and today's environment, that is work from home. Another reason leading to that of obesity. So exercise, healthy food, green food is more important.
You missed one medicine, that is Epis, I think. Epis is one of the best remedy for right-sided poly.
Yes, sir. EPIS, we can give even Ufrinum also, intermediate in between also, which helps in the maturation of the follicle. Ufrinum is also being indicated sometimes, and we can give intercurrently also Ufrinum.
Okay, anyway, let us, it is the time for discussion, and those who want to participate can raise your hand so that we will allow you to unmute yourself and ask your question. Now, it's up to Dr. Remadevi Ambari. She is having more than 2,000 successful infertility cases in her kitty. So we proudly invite Dr. Remadevi Ambari to have a question or have a speak to Dr. ANSHU.
Can you hear me?
Yes,
Yes,
yes.
ma'am, I can hear you.
Okay. I'm sure it was very nice session. You have explained very nicely. But I have got one doubt. You had told that the fasting insulin level, that is 4.5:1 ratio, it should be. Can you explain it?
Ma'am, 4.1 is to ratio is in relation to the, it's not into relation with the
4.5.
fasting blood sugar level. The blood sugar level, maybe fasting or TT, is raised. So
Yeah.
glucose tolerance test is to be required. In
Yeah.
case of the LH and SSH ratio is to be
1:1. I know.
Hanji ma'am.
Yes.
Yeah, we can hear. Tell me. Tell.
So LH level is raised and SSH is less.
I
So
know.
insulin resistance is there because because of the insulin resistance, the insulin cells are increasing. Again, the body is जो जो चेक होने चाहिए थे इंसुलिन सेल्स जो रुक जाने चाहिए थे रुकते नहीं है. उनकी बाइंडिंग जो होती है जो बाइंडर्स भी होते हैं वो भी स्ट्रक्चर चेंज कर लेते हैं और इंसुलिन और क्रिएट होता जाता है. जब इंसुलिन और बढ़ जाता है तो दैट लीड्स टू इंसुलिन रेजिस्टेंस and ultimately it leads to
Madam,
that of androgen secretion.
I know. ठीक है, ठीक है, ठीक है.
Most of the participants have no idea.
It is obscure. So some few things are obscure. We are not able to find out the reason.
I know. Samsya.
Is it
Well,
okay, ma'am?
Okay, ma'am. Okay, Anshu. It was very nice session. You come with all the other subjects also, endometriosis, endometriosis and all. Okay. Thank
I
you.
can come on endometriosis also. मैम मेरे को ना थोड़ी ऑडियो की आपकी यहाँ से प्रॉब्लम आ रही है. I can come with the endometriosis with that of dysmenorrhea relationship. I've got a
Okay.
beautiful presentation.
Other causative factors also you should tell. Okay. For infertility.
Ma'am,
For
can you
infertility, other things affecting infertility you should tell. Okay.
Okay, definitely.
Okay. Thank you. It was very nice session. Keep it up.
Thank you, ma'am. Thank you.
Come
I'm
again and
honored,
again.
ma'am.
Okay.
If you have appreciated, I'm honored.
Thank
No.
you.
It's another button coming. That is Dr. Hariharan. He is a retired chief medical officer from Kerala. So let us have a discussion from Dr. Hariharan, sir.
Dr. ANSHU. Very nice class. Very nice, very nice. Can you hear me?
Anji sir, I can hear you.
Can you hear me?
Sir.
Anji sir, I can hear you.
Yes, sir. Yes, sir.
Okay, doctor. Your class regarding PCOD and PCOS. Very nice lecture. And see about insulin resistance. One of the best medicine is cinnamon. You can use it and try it. Cinnamon.
Okay, sir.
Cinnamon.
Okay.
Along with, while you are using the applying the constitutional medicine, along with you give this medicine also. So
Okay.
you will get fine result. That cinnamon.
Cinnamon, sir, which
tincture.
potency?
Cinnamon tincture. You must use cinnamon tincture.
Okay, we can use in a tincture form. Okay, sir.
Okay. See, cinnamon can reduce the insulin resistance significantly, which is the main cause for both diabetes and PCOD. Okay.
Yeah.
See, cinnamon can decrease the amount of glucose that enters the bloodstream after a meal by interfering with the numerous digestive enzymes. So use this cinnamon and find the result.
Okay.
See, the regulation of frequency of menstrual cycle among the women with PCOD, it will regulate that also. That is the effect of the cinnamon. See, asparagus is another medicine. Asparagus. Can you?
Asparagus. Okay.
Okay, asparagus. That is, see, in Sanskrit, it is chadaveri. Chadaveri. Have you heard about it?
No.
No. Chadaveri, you can use it. Chadaveri, that is hundred of cases. I see. I used this for 100 of cases. Chadaveri. That managing, we can manage the PCOS induced by weight and bloating. That is the main indication of Chadaveri.
Chadaveri.
Yeah,
Can you spell it?
And another name is asparagus.
Asparagus. Yes.
The asparagus will control the acne also.
Yes. Sir, I have
Acne
used
also.
in the case of acne. Asparagus.
Acne.
Yeah.
That the asparagus will control that also. See, another medicine is, the tribulus. Have you heard about this? Tribulus.
Okay.
That is also a very good medicine for PCOD cases. Tribulus. Along with, we must use along with the constitutional medicine, you can use these tinctures also. Then it will give promotion of this curing.
Mhm.
Very fastly that will promote the curing. See,
Okay.
in tribulus, it affects fertility in women and it increases the FSH level, improves the ovulation in PCOS cases.
Mhm.
So try you along with this, you
All
try
are
these
these
tinctures also.
all these are to be used in mother tincture form.
These are all in mother tincture form. That is, these are all
Okay.
pathological remedies. While we are using the constitutional medicine, along with that, you can use the pathological medicines also.
Right.
That will create, see, very easy cure
Mhm.
of this PCOD PCOS case.
Oh, okay, sir. Very good.
Thank
Very
you, sir.
good.
Thank you for enhancing my knowledge. Thank you.
And now it is up to Dr. Manoj.
Thank you, Dr. Thanesh, for giving an opportunity to participate. Nice presentation. Definitely, you can see a lot of ignited minds in the IFPH platform. Young persons, really talented one. And one thing interesting is that regarding the cinnamon, Honeyman advises not to use cinnamon in persons with menstrual problems. You can see in the chronic disease, diet regimen in the form of diet. It should be interdicted. That's the point I would like to mention here. Thank you.
Thank you, Dr. Manoj. And it's up to Dr. Rambaresh Sir, speak in short way.
Thank you, Dr. Danesh and Dr. Manoj and Pranam, Dr. Hariharan sir. Long period not present in IFPS. So congratulations, Dr. ANSHU. Very good presentation. Excellent session, PCOD.
Thank you, sir.
Cause and medicine. Role of miasmatic remedy. Puja is the best remedy. Epis and cinnamon, Dr. Hariharan sir. Dalchini. Very good remedy for diabetes. So very, very thanks, Anshu Malaji, everyone.
Thank you, sir.
Thank you.
And
Thank
now
you,
it's
sir.
time to, before closing the session, I invite Dr. Bob Lim to say a few words, and you can have you can say a vote of thanks to the session also. Dr. Bob.
Thank you, Dr. Danesh. Before I start, I would like to wish the Indian homeopath a happy Independence Day. I know it's near my birthday, so I can remember very well. I arrived in India during Independence Day, and there was very big traffic jam. Everybody is going back home the next day. So anyway, congratulations to all the Indian homeopath, and also I'd like to say my congratulations to Dr. ANSHU from Chandigarh. It's in Punjab. I've been there also. He had presented a very good subject on PCOS, very detailed, and he followed up with differential homeopathic remedy, and that is very good, and it attracted a lot of attention and interest tonight. With all the doctors asking questions and to and fro, a very good dialogue. And on behalf of IFPH, I would like to show our appreciation and say a very big thank you for sharing tonight's webinar. And I hope that you will share your experience again in the near future. I would like to hear from you. There are many things that we can learn from you tonight. Thank you very much. Over to you, Dr. Danesh.
Thank you, Dr. Boblim. Tomorrow we will have a session from Dr. Naveed Iqbal Avan, and the subject is Management of Depression Disorder with Homeopathy. Dr. Avan is from Pakistan. And thank you, Dr. Boblim. Thank you, all the participants, and thanks, Dr. ANSHU for a big evening here. And we are very happy to have such sessions every day. Hope all of you will be joining at tomorrow at the same time. Thank you. Good night. It's over to Dr. Manoj to moderate the Malayalam session.